Good afternoon, team. Somebody confirm if you can hear me. Ogutu, confirm you can hear me, please.
Yes, loud and clear.
All right, thank you, thank you. Good afternoon once more. Let's give our colleagues some few minutes. I'm thinking we can propose to start at 10 minutes past 2. Meanwhile, I can see we're still very few. We are about slightly above 150. That's 161. I'm kindly requesting that we reach out to our other colleagues so that they can join in. Let's propose to begin at exactly at 10 minutes past 2. Thank you. Yeah, good afternoon once more. I guess we can begin because of time. It's 11 minutes past. Apologies. I think I got dropped. My network seems to be misbehaving. Sorry. Ogutu, confirm you can hear me? Sorry.
Yes, you're now clear.
Okay. Sorry. Apologies. I think my network is not so stable. Let me change. All right. So yeah, so sorry. Apologies for that. So again, once more, let me take this opportunity to welcome each and every one of us into our virtual training. During our release, I think we had promised that we'll organize a series of trainings just to update ourselves on some of the changes and also just build the capacity of all the service providers. So our main objective today is just to be able to do a quick showcase, just take you through how to perform various user roles management. We'll also be able to do a demo on the stock management workflow in KenyaEMR3.x. And then we should also be able to illustrate how to perform various operations on stock items. So before we begin, apologies from Dr. Lily. She's engaged in another meeting, but we have our blessings. So we will continue. And before we proceed, I want to request a few of our colleagues to just make some quick remarks, and then I'll quickly walk you through the agenda. And then we will go to the various sessions that we'll be able to take you through today. So I don't know whether George Owizo or Dr. George Odhiambo, George Owizo or Jacob Odhiambo is in the call. George, are you in the call? Probably maybe just a few remarks before we begin. Sorry, if George is not in the call, Diana, I don't know, Diana To.
Good afternoon, everyone. We are so excited to have these sessions. This is just one of the many that we have planned for this month and next month. So feel free to engage. We are very happy to receive feedback on what to improve in the system and also what we can change. So let's be interactive. There's a Q&A chat box. So please feel free to ask as many questions as you have, and any feedback we'll be happy to receive. So back to you, Songok.
Thank you. Thank you, Diana, for your remarks. Moving on, I want to request any of our colleagues from DoD who is in the call. Anyone from DoD? I don't know whether Gonza is in the call, or Lydia, or Dr. Maswai, or anyone from DoD on behalf of the team, DoD team. All right, USID. Okay, CDC, I think I can see Daniel Mangi. I don't know whether Dr. Kimani has also joined, but maybe Dan, you can take it up. And if Dr. Kimani has joined, you can also welcome him to just make a few remarks before we begin. Daniel?
Thanks, Songo. Confirm you can hear me.
Yes, I can hear you loud and clear. Dan, go ahead.
All right, thanks. So good afternoon, everybody. Mine is really to appreciate everybody for joining the call, and especially for the partners for, not just continuously using KenyaEMR, but also for the feedback that you provide, which I think has been really useful for the Palladium team, and also appreciating, Palladium for, taking the feedback and developing the system. And actually not just developing the system, but as you can see, we have KenyaEMR has evolved from, a system that is focused, that used to focus on just not focus on HIV, but now it's a system that can be used facility-wide. So kudos to the Palladium team for the work that you have done on that. But also want to acknowledge NASCOP's leadership and also for convening this training session. So looking forward to an interactive learning experience for the next couple of weeks. But Songok, I see we have our team from Western Kenya, so perhaps maybe you can give us maybe Odingo or Makora an opportunity as well to speak. Thank you.
Thank you. Thank you, Dan. Thank you, Daniel. And I think it's also appropriate for us from MOH to register the support that we're getting from your end. And I feel it's still in order to allow either Boniface or George to just make some quick remarks. Makone, you can go first. Boniface.
Yes, thanks. Thanks everybody. I think from our end, George will speak on behalf of the Western Kenya team.
Okay, thanks. George?
Good afternoon, everyone. Happy to be here. I know we've made lots of steps in making KenyaEMR be more responsive to program needs. And the phase we are in right now, just to reiterate what Daniel said, we moved from doing the HIV program only to now a hospital-wide system, which I think is going to be a big game changer. And building it to also align with the current government priorities of digitization and claims from SHA, I think we are on the right path to making this product more useful. It's more for service delivery, not just for data capture. It's for service delivery and also for responding to the claims that I know is now the prime thing in health system delivery today. I'm looking forward to also learning what is new, and also hopefully by the end of this we'll be getting some dates as to when shall we get this out to the site so that we start using it. Thanks, and back to you, Chair.
Thank you. Thank you very much, George and team from CDC. Like I said earlier, we really do appreciate the support that we constantly get from the team. We recognize the presence of all the teams, our colleagues from MOH, partners, service delivery partners, the county teams. We really appreciate you for the support that we do get, and of course in advocating and supporting in scaling up and the use of EMR at the facility. Now that you're talking about facility-wide EMR, KenyaEMR3.x. Allow me to, I don't know whether you're able to see my screen. I wanted to quickly just take you through the agenda. Ogutu, confirm you can see my screen?
Yes, clear.
All right, thank you very much. Yes, so our agenda is very short. So we intend to cover this within the 2 hours that is allocated for this training. Again, like registered apologies from Dr. Lily and Dr. Evans Imbuki. Dr. Eric was to join us, but I think they're also held up in some other engagements. Lily is in a physical meeting, and Dr. Evans Simbuki, who is our lead for commodity, is also engaged in a physical meeting. I think he was making a presentation this afternoon. So they may not be able to join us, but in case they'll manage based on how the engagement will run, we'll also allow them. Yes.
Sorry, I know you are sharing. You can't see. Dr. Eric has his hand raised up.
Oh, sorry, sorry, Dr. Eric. I was sharing the screen. I hadn't seen you, Eric. Thanks for joining. Please go ahead and say hi to the team and a few remarks on behalf of the commodity team. And apologies for not having seen your hand. Dr. Eric, go ahead.
Good afternoon. No problem, Sonko. Okay, I've just joined now. Yeah, so you have done the introduction. So just I want to appreciate everyone for joining this meeting. We know we had the physical training meetings in sometimes last year. So now it's good to see that Palladium team is capacity building the healthcare workers on the issue of the KenyaEMR3.x. We hope it will make our work easier. I know there are concerns that the KHIS is down. I know you will be able to address that because you know it better than me. There are some cock, but just want us to follow up through. I know there are some facilities which are already using the 3.x. So even for those who have not started using, it's a nice and good platform for us to learn. Thank you. Over to Songkok.
Thanks, Dr. Eric, and you're putting me on the spot on matters KHIS, but it's okay. I'm not sure that I'm the right person to address. Fine, I know KHIS well, yeah, but I think some of the issues that we're experiencing right now are beyond some of us. So I think we can probably just address that in another forum when the time comes. But thanks for finding time to be with the team. I know you've walked the journey with us. I remember when we were conducting the county sensitization meeting in the introduction with the facility-wide, you are with us, and we really appreciate you for creating time to just walk us through this journey, because these modules are very, very important, especially when it comes to ensuring that we manage our stocks at the facility level. So your presence and your inputs is very important. So we really appreciate the commodity team, of course, under the leadership of you and Dr. Evans Simbuki. Right, thanks so much. So I want to quickly just take you through the agenda. I think I've already alluded to the objectives. So Ogutu will take us through the first part. It's a very short slide deck, just to just give us a rundown of what we expect, and then Frida will take us through another short session on user roles management, and finally she'll be able to take us through the demo, and the specific focus will be how to perform various operations on stock items, and of course pharmacy drug dispensing effects on stock, on how then are we able to ensure that we take care of what we have, what we need, and what are some of the alerts that you need to look out for in terms of ensuring that you don't run out of drugs at the facility level. Then we'll open it up. I think Diana had already alluded to this. We'll open it up. Your feedback is very key, so we'll open it up for plenary. Of course, that would be partly a Q&A and feedback from your end. Then after that, we should be able to then close the meeting. So at this point, without wasting much time, allow me to hand this over to Ogutu. Ogutu, you will take us through the first bit, the slide deck, then usher in Frida. After that, I'll come in to moderate the Q&A and the plenary session. So over to you, Kennedy, and thank you from my end. Ogutu, can you hear me?
Yes, I can hear you.
Thank you. Over to you.
I'm sharing my screen. confirm you can see my screen?
Yes, I can. You can just put it on slide 2.
Is it now visible to everyone?
Yes,
Can you
it is.
confirm?
Go ahead.
Okay, thank you so much. Good afternoon, everyone. I welcome all of us to this session. I'll take us through the introduction bit, where we'll be able to see what to expect in the demo. So we'll be taking you guys through the stock management and pharmacy dispensing modules in KenyaEMR. So the session will cover the purpose, features, and benefits of the commodity management module in KenyaEMR system. So the screenshot is the landing page of the module when you log into KenyaEMR. So when you access the stock management module, you'll be able to see the landing page, that is the home page for the stock management. So the objective of the today's session is to reinforce capacity to users and create familiarity with the commodity management module, its functionalities, and its purpose in managing health facility resources. So the focus areas include user role configurations in relation to stock management, adding stock in the system, all stock operations within the module, and also pharmacy dispensing. So what is commodity management module? The module is part of KenyaEMR system designed to track and manage the inventory of medical supplies, drugs, and other commodities. And why is it important? It helps in ensuring that essential commodities are available, prevents stockouts, reduces wastage, and improves overall patient care. Some of the key features of the commodity management module, we have inventory tracking that tracks the quantities of commodities in stock, including batch numbers, expiry dates, and locations. We also have automated alerts that notifies users when stock levels are low, when approaching expiry, and when it's time to do to reorder for the items that are due to expire or are due when the levels are low. So the order management module facilitates the creation, approval, and tracking of orders for the new supplies received, and also the ones that have been issued. Commodity usage monitoring, the module records the consumption of commodities, linking usage to specific patients or services that have been provided. We also have the reporting and analytics as some of the key features of this module, where reports are availed at both facility and county level to track consumptions and usage trends, as well as stock levels for forecasting purposes. Benefits to the health facility. The three key benefits of this particular module to the health facility is improved resource management, whereby the module helps in managing resources efficiently, reducing the likelihood of stockouts or overstocking. We have enhanced decision-making feature that the real-time data from the reports supports informed decision-making regarding procurement and supply chain management at the facility and county levels, compliance and accountability. This module ensures compliance with the regulatory requirements and maintaining accountability for inventory management. That is all from the introduction bit. I will usher in Frida Huisho, who will take us through the practical session walkthrough of the system. Thank you and welcome, Frida.
Thank you, Agutu, and good afternoon, everyone. Give me 1 minute to share my screen. Songok, just give me 1 second. I'll be sharing my screen shortly.
No problem, Frida. So meanwhile, as Frida is sorting out issues on our end, one announcement that I forgot to mention is that if you have any questions, once she starts to do the demo, kindly let's use the chat box. We have a team here who will be able to respond to any of your questions. If you have any ideas, also just post them, because that would really help us in terms of improving the system to make it user friendly, and of course respond to the needs of all of us, especially the teams at the facilities. Yeah. So Frida, you let us know once you're ready.
Hi, Songok. Looks like we have a challenge with all our servers are down from our service provider. I'm wondering if we can postpone this to another time because all the servers are down.
Oops. Wow. Okay.
Maybe we can give our team, they're trying to reach out to our service provider. Can we give them 5 minutes? And
yes,
then
please.
I'll come back after 5 minutes and then we make a decision.
Okay. Yes, please. Let's be patient a bit. I would really hope, I'm hoping that they'll be able to sort that out so that we can proceed with this training. Yeah, technology at times can let you down when you need it most. So let's be patient a bit and hope that things will be sorted out. Apologies once more. So meanwhile, I think there are already some few questions we could be addressing. There's a question from Boya Franklin. Is asking whether we have a lab module. I know we've just talked about pharmacy and more specifically taking stock and tracking ARVs. So he's asking whether we have a module that would help us also track commodities that are being used or items that are being used in the lab, like for instance, test kits, the resources that are used for EID testing, and even the tubes that are used to collect samples. Oguto, can you respond to that meanwhile, as Frida is trying to sort out, the team is trying to sort out the technology bit?
I can respond to that, Franklin. Yes, we have a commodity. So the system allows you to load both non-pharmaceuticals and pharmaceuticals. So I believe things like test kits fall under non-pharms. So we have that. So you're also able to move the non-pharms, do the different operations, like be able to move them from the main store to the laboratory dispensing area. And we also have a way in which you can actually be able to document when these products have been used or consumed. So yes, we do have laboratory commodity module as well. It's not a big component, but it's part of the stock commodity that we have in the system.
Thanks for that response, Frida. Meanwhile, again, as we wait, there's another question from Bernard Momanyi. So Bernard is asking whether we are able to generate the reports, and I think more specifically is referring to the FCDRR, and whether we are able to upload it to KHIS, of course, after verifying and confirming that the numbers are correct. And I think that is what you ought to cover. However, I think for uploading to KHIS, you probably need to have ensured that your EMR is installed or as air to be able to upload your report directly to KHIS. And this applies to the other reports, but probably maybe Frida, you can just add your voice on the same, meanwhile as we wait.
Yes, we have the FCDRR reports in the system. Currently, you're able to generate it, and then you'll be able to get your consumption rates in the EMR. It's available.
All right.
I believe it's in the same format as whatever you have on the in your physical or in the physical registers. So you can be able to download it in Excel or CSV, and just the way you normally upload the one you get from I don't know which source, you can also be able to just upload it to KHIS.
All right, thank you. The other source is either the DAR or the web ADT from the facility, because I think those are the main data sources for FCDRR and FMAPs. Yeah. Yeah, I know. I can see there's so many questions that are coming in. We can fast. I can quickly sample them meanwhile as we wait. So there's one from sorry, yes, Diana. Have we made any headways?
Yes, I think we are back, so we should be good.
Thank you.
Confirmed, they're back.
Thank you very much. Thank you. So Frida, I think you can go ahead. Ogutu and team, we can be responding to the questions on the chat because of time. I can see we are already way past the time. Frida, over to you.
Thanks, Franklin. I'm just sharing my screen right now. So good afternoon, everyone, once again. Sorry about the hitches. Please confirm that you can hear me Songok right now.
Yes, I can hear you loud and clear, Frida, and I can see your screen. Proceed.
Yes. So I'm going to try and be a bit fast, but at the same time, I'm also going to try and make this process easier to follow, because I know most of the time we've gotten concerns that the stock module in the EMR is a bit complex, especially when being taken through virtually like this. So I'll try my best to make sure that you understand each and every single step. So what you're going to look at for this session, is basically we're going to look at for a facility that is starting for the first time. What do you need to do to be able to ensure that you're able to perform the stock operations comfortably, and you're also able to reach a point where you're able to dispense drugs? So we're going to look at the specific roles that the different users are supposed to have to be able to perform the different stock operations. Then we'll try and add stocks. We'll do 1 or 2 drugs just to be able to see how the process is. Then after that, we'll transition to now trying to dispense this drug so that you also be able to see how the pharmacist will be able to interact with the module at that point. So when you're using the stock module for the first time, I've mentioned the roles. The first thing is roles. Roles is very important. If you don't get it right from that point, then you'll not even be able to proceed and be able to see drugs or be able to dispense drugs. So for you to be able to give roles, we are looking at roles for 3 specific people. So 1, clinician. So in the EMR right now, there are certain roles that you have to be able to give the clinician for them to be able to, for their prescriptions to be able to be visible or dispensable by the pharmacist at the dispensing area. You have to give roles to the pharmacist, again, for them to be able to dispense drugs and perform stock operations. Then lastly, you have to give roles for reporting. We also have stock reports that we'll be able to look at. So for you to be able to access or be able to generate those reports, you'll be able to require roles. So for you to give roles, so the first use case you're going to be able to perform is to be able to create accounts for these 3 people, give them roles. Then now we'll move to the next step. So to access the roles place, you'll have to go back to the 2.x, KenyaEMR home, click on developer. You have to be an admin to be able to access the developer module. Click on legacy admin UI. Then once you're here at the administration, we have the users. So at this point, you create manage users. Then if your user already exists, you'll simply search for them. If your user doesn't exist, you'll add them. For this specific training, we're going to add at least a user so that you see how to go about it from scratch. So we'll add a user, and the user that we'll add, we'll assume the user is a clinician. So I'll give my user a name, test clinician. My user is a male. Then you ensure you say that your user is a provider so that they can be able to also be able to fill forms in the system. Then you'll give them a username. So I'll just say clinician. And then I can give my user a password of clinician 123. And then I confirm the password, clinician 123. Then you give them the necessary roles. So this is where now you get to give them the roles. So for a clinician, you'll be able to give them the clinician roles and all the roles that pertains to clinicians, which I'll not really go through all of them because that is not the main point of this training. But the main point of giving roles for the clinicians for 3.x is to be able to see their prescriptions when the pharmacist is trying to dispense those prescriptions. So the most important thing here is you need to be able to give the clinician inventory roles. So any role here that has inventory, so you give to the clinician. So there are 6. So that will be the inventory admin, inventory dispensing, inventory provider access, inventory clerk manager, and reporting. Okay, so those are the key roles that your clinician will have to have for the prescriptions to be seen and be dispensed on the other side. So I'm not going to create this account because I want to do the same for the pharmacist. So for the pharmacist as well, you'll be able to give the inventory roles. So you'll give them all that. Then you'll also be able to give them any role pertaining to stock. So you have the stock controller manager, you have the stock management base role, and then you have the pharmacist role, and then pharmacist or 3 pharmacists. So you'll give them those roles for the pharmacist. For the inventory, for the reporting account that you'll also be able to create so that you're able to generate the reports, You'll also be, actually, you'll give them the inventory roles without any other roles, because that account is basically for generating the inventory, the stock reports. So for the inventory accounts, you'll basically give them these 6 roles minus all the other roles that I've given. So if you look at all these roles that I've given, the most dominant role for all these 3 users is the inventory roles. So this is a must for all clinicians in your facility, especially clinicians at the OPD and also clinicians at the CCC, because if the facility is doing inventory management, I believe it's both for OPD prescriptions and also for CCC. So these are a must. And then for the pharmacists, you have to be able to give them the stock management base role, the stock controller manager role. All right. So once you've given the roles, now we're going to proceed to the different stock operations. So to access the stock module in KenyaEMR, you click on KenyaEMR modules, then you'll be able to see manage stocks. So once you're here, we have the overview where you're able to tell a few details about your stock. So you can be able to tell at overview your stock that is expiring. This is configurable when you're entering stock, so you can be able to see the stocks that I expired. Yes.
You may need to zoom in a bit. The print is too small, and I think it's not very visible to the participants. So if you can zoom it a bit, I think that would be helpful. Thanks.
Is it visible now?
Yeah, much better. The print was too small, but it's much better.
Sorry about that.
No,
so first thing you'll see on the stock module is the overview, where you'll be able to see. The first thing is the detail about your expiring stock, so you can be able to see the stocks that are expiring. This is based on the dates of expiry date that you'll be able to see that you enter when you're entering your stock in the system. So you'll be able to see which ones are expiring in the next 6 months, and you can also be able to view a line list of those stocks that are expiring. So this comes with alert. So as you can see down here, it just gives you a sample or just a small list of the drugs that are expiring, but you can also be able to view all, which we're not going to look at right now. Then you'll also be able to tell and see your stock that is currently out of stock. So if you had specific number of drugs entered, but now they're out of stock, so you'll be able to see the ones that are below the minimum. Again, these are configurable when you're entering stock, and above the minimum figure, which you'll also be able to configure when you're entering stock. For any stock that you've been able to dispose, again, either they've expired or of poor quality, that is also, you'll be able to see them here. Of course, you'll be able to see this here. Once you've performed this stock operation of disposing this stock, then you'll be able to see a summary from the dashboard. Any stock that you receive from anywhere, be it from KEMSA or other facilities, you'll be able to see down here under receiving. And any stock that you've issued to other facilities, maybe it's you've donated to another facility, you'll be able to see them down here as well. So the next thing is the items. So the items is basically the list of drugs, minus the quantities and all that that we currently have in the system. For the facilities that are currently using facility-wide system, there's a list, a CSV that we normally update every other time, so that when you're searching for drugs, either when you're doing, you want to add pricing to the drug so that you're able to charge, or you're doing your stock, you want to add a drug, you have to be able to make sure that the drug is in this list first for you to be able to perform those actions. So this is the list of drugs, both pharmaceuticals and non-pharmaceuticals that we currently have. So if you just want to see if a drug is existing in the system, you can always just come here and be able to search for that drug. Let me search for paracetamol. So if you search for paracetamol, then you can be able to see the paracetamols that we have in the system. If you search for ibuprofen, for example, you'll be able to see the ibuprofens and the strengths that we have in the system. So if you search for a drug and you miss it here, then we highly request you to reach out to us so that you can be able to add the drug to this list so that you're able to find the drug. But I think over time we've been able to work on the list, and currently we have most of the drugs, if not all, in the system. We also have sources. So this is where now you get to specify where you're receiving your drugs from. So you'll be able to, I'm just taking you through the overview first, then we'll come back and start doing the operations. So you'll be able to, whether it's KEMSA or another facility, you'll be able to add your sources here. Then we have the user role scopes. Again, I spoke about giving roles. So you give roles twice. The first role that you give, we had given the other side. Then I'll also be able to show you how you give roles here as well. Then we have locations. So this is where you get to specify where the main store that you have in the facility, that is the main point where you're getting your drugs, both pharmaceuticals or non-pharms. And then you specify the dispensing area that you have in the facility so that when you're doing your operations, you can be able to track how the stocks are moving from one place to the next. We'll be able to look at that as well. Then there's the reports. Again, we'll be able to look at the reports, the stock reports. And then I'll not get into the settings for now. But it also leads to the admin part of the 3.x, where you can be able to configure other things as well. So the first thing you want to do at the facility when you get here is you want to be able to, first of all, load this list. So again, this list is provided for by Palladium. It normally comes with the package, the upgrade package. So you get the list, you load the list so that you're able to get the drugs in the system. So once you've done that, then the first thing you need to do is to go to locations, just specify or configure the locations that you have in the facility. So how do you do that? You simply click on create location. So if you're in a facility called Onyinjo, the way we are, so the first location you want to create is main store. So you'll say, this is where you are. When drugs come to the facility, this is the first point where all the drugs or any stock goes to before they are taken anywhere else. So this will be your main store. And then you also make sure this is also a login location. And I'll be able to show you why it's important to put a login location. So once you've done that, then you save. This will most likely not save because I have another main store. So let me just rename it to Onyinjo. So Onyinjo main store. The next thing you want to do is now be able to create the different locations where these drugs will be dispensed from. So for example, assuming Onyinjo has a pharmacy at the CCC, they also have another pharmacy, maybe at the OPD. So the Onyinjo team will create Onyinjo. So they'll create Onyinjo main pharmacy, Onyinjo OPD pharmacy. And then for the OPD pharmacy, the tags that you'll tag is the login location.
Frida, sorry for the interruptions again.
Sure.
Yeah, I don't know. There's so many participants who are complaining that the screen is not moving. It's moving from my end. I'm suspecting probably it could be issues with the network. So I would suggest probably they may need to exit and then rejoin, because some are complaining of audio, some are complaining of the slides, is that the slides are not moving. But it's moving from my end, and I don't know whether there's anyone else who is able to see the screen moving. Diana, confirm if the screen is moving from your end.
Yes, it's clear and moving from my end.
Yeah, so I'm requesting probably, yeah, thanks Joe for confirming that it's also moving. thanks, Nyanaro, for confirming. So the rest of the participants who probably are having challenges, you may need to exit, then rejoin. And then I think there's also some technical issue for people who are not able to join. I think what you need to do first, or what they needed to do first, is to register. And you may not be able to join. I've noticed you may not be able to join using this link on your phone. So you will need to register, and then you'll then be able to join. But you can't join directly by clicking the link on your phone to this call. So I think that's the challenge that most people are also experiencing. I think I've received that complaint. So probably what you need to do, currently register, then you join. For those who are having difficulties in viewing the screen, please exit, then rejoin again. And probably you need to check your network. Thanks. Go ahead, Frida, and apologies for the interruption.
No worries. So for the OPD pharmacy, so you'll create the login location, and then you'll also be able to tag main pharmacy. So you'll have two tags, so login location, main pharmacy, and then you'll save. Again, if they have a CCC pharmacy, you'll also be able to come here, again, still create Onyinjo CCC pharmacy. And then you'll tag still login location and main pharmacy, and then you save. The reason why we are tagging login locations to these locations is because when you're performing certain locations, you'll need to assume that you're in those locations for you to be able to perform those locations. And we'll be able to see how that plays out. So I'll just refresh. So normally when you refresh, then you should be able to see all those locations appear. But again, I think we are still having kidogo lag from the downtime that we've just had. But we'll come back again and check if they've already appeared here. So once you've set up the location, the next thing is you need to set up the sources. Where are you getting your drugs from? So it is from this list. Unfortunately, this list contains so much. This is our test instance, but I'll just show you how to go about it. So once you're at the sources, you'll click on add new source. So you'll come here. Most facilities get drugs from KEMSA. So you'll be able to say Kenya Medical Supplies Authority, which is the short form for KEMSA. Then you'll be able to indicate whether drugs that you receive from KEMSA are donations or commercials. So you'll choose either. Let me just say if there's another KEMSA. So you'll say commercial, you save. Again, if you're receiving drugs from another entity as well, assuming it's meds, Mission for Essential Drugs, you'll be able to document that as the full name as well. Then put in the code and choose whether it's donation or commercial. So if the same entity gives you drugs, sometimes they sell for you drugs, sometimes they give you a donation, you'll put in commercial, and then you'll come back again, add the same source, but then now label it as donation. If you're receiving drugs from another facility as well, sometimes the list of facilities are endless and it depends on the need. So you may not be able to add all of them here, but the moment a facility approaches you that you give them stock, so you're doing stock out, then you just come to sources, then you can add the information of the facility here. Assuming Onyinjo is receiving drugs from Kombewa County Referral Hospital, so they'll be able to write their full name, Kombewa County Referral Hospital, and then they put the source as a donation, and then they save. So again, if you control refresh, you'll be able to see all those sources that you've added here. They'll be able to be visible here. You'll be able to see the name that you entered, the code or the acronym. You'll be able, you'll be able to see the source type, whether the entity gives you donations or commercials, and then you can also be able to edit this information. You can be able to edit, you can be able to delete and write it well if it was not written well, but you can be able to change if at some point they stop selling you drugs, a nice donation, or they stopped giving you drugs for free and now they're selling, you can be able to change that. If the entity no longer supplies you with the drugs, you can also be able to just delete the location completely from the system. But because of the fact that we'd like to track changes over time, we highly discourage that you don't delete any of these stock sources, so that you can be able to tell in 2024, for example, you can go back and tell who was giving, which you received this type of drug or this type of stock from this and this specific entity. So once you've created your sources, so now you're good to go. Sorry, you're not good to go yet. You have the user role scopes. So you remember we spoke about giving clinicians roles, giving pharmacist roles, and also the account that does reporting. So this is the last bit where you now also give the last part of roles for now the different users to be able to perform the different operations in the system. If you just create the users the way we created and then you stop there, still you'll not be able to, unfortunately, dispense drugs. So you'll come here, you click on add new user roles. You look for your clinician. I'd created a clinician account, and then you give them the roles. So for the clinician, there's so many roles. For the clinician, this depends on the role you gave them. I gave mine all the roles. So for the clinician, we are keen on having them being given inventory admin. So you'll search for inventory administrator. So that is the role you're going to give clinicians. It is the same role you're also going to give all the pharmacists. Then you're going to enable their account to be active. If these guys are on contract and you want them to be able to only access this kind of information for a limited period of time, then you can specify the period in which they can be able to access the EMR or be able to perform the stock operations. If the clinician is there for a period that's intermittent, you can just say they're permanent staff, or if they are MOH or something like that, then you give them the roles that apply. So unfortunately, for now in the system, you have to give clinicians all these roles, even though the clinicians will not be performing these roles. But it's just for them to be able to, for us to be able to consume their prescriptions. Then you'll click again the locations where we expect to see their prescriptions. So for the clinicians, the location that is of interest is main pharmacy and maybe CCC pharmacy. So you click on the main pharmacy and you make sure you toggle so that it basically farms the selections and then you save. So that is for the clinician. I'd already given this clinician the same role, then you save. For the pharmacist, it is the same thing. Again, you'll search for your pharmacist. By that time, of course, you'd have created the account as we had done before. So you'll search for your pharmacist. I have a pharmacist. The role remains inventory admin. You give them inventory admin as the role, and then you enable them to be able to access these operations for whatever period of time. Then I understand that there's some facilities where some pharmacies are just based in the main farm, and some pharmacies are based in the main store. So depending on what the pharmacist's role is, you'll be able to give them, even if it's just adjustment and disposal, or if the pharmacist is supposed to be doing literally all the operations like most facilities, then you'll be able to give them all the rights to perform all those operations. And then for the pharmacists now, depending on where they're stationed, if the pharmacist is at the main store alone, then you'll be able to give them access to be able to perform these operations only at the main store. If this pharmacist is just one pharmacist in the whole facility, then you'll be able to give them rights to be able to perform operations literally everywhere. So you select, you toggle, and then you save. Again, I'm not going to save. I already gave the pharmacist roles. Then the last account is the reporting account, the account that allows you to access reports, which you'll be able to see later on. Again, you'll be able to come here, search for the account. I already have my account here, but now for the accounts, for the reporting account, it's different. So instead of inventory admin, we're going to give them the role inventory reporting. So you scroll down, then we have inventory reporting here. So that basically gives them the access to the reports to be able to generate the reports. So you give them inventory reporting. Again, as I mentioned, currently in the system, in the version that we have, you just have to provide these roles. But the roles section of 3.x is something that our devs are currently trying to align. So you'll just give them the roles to be able to perform these operations, even though we know maybe that can be an HRA or someone like that who does not really do these stock operations. Then you'll give them access to the main store so that they can be able to generate reports concerning the main store, the main pharmacy, and also the CCC pharmacy. Then you'll be able to save. So once you've done that, if you come here, come back to the user role scope screen. Now you'll be able to see your users, like for example, the pharmacy. You'll be able to see the user, the role, where they can perform the different operations, the operations they can be able to perform, whether they're permanent, if they have a period in which they're active, and if their accounts are enabled or is currently active. You'll be able to see all that. For the reporting, you'll also be able to see, you see now the reporting is different from all these people. So it's inventory reporting. Again, you'll be able to see all the other details. Same with the clinicians and everyone else. So once you've done that, now you're ready to do stock operations. So for stock operations, you'll click on operations. So once you click on operations, this is how this place looks like. So you can be able to perform different stock operations in the system. It's exactly the same way you can be able to perform the different stock operations at the facility. So you'll click on Start New. So when you click on Start New, we have the different stock operations that you can be able to perform from the system. You can do stock adjustment, both positive and negative. You can dispose your stock. You can do opening stock. You can receive stock. You can do requisition. You can return stock. You can do stock issue. You can do stock take. And you can also do transfer out, can give stock to another facility. So what you're going to do, assuming this is a new facility that is starting up, we're going to do opening stock. So for the first time, if you're using the system, you have to load all your stock in the system. So that is what you're calling opening stock. So for you to do the opening stock, let me just close this. So first things first, again, now we are in a place where we are now doing assumptions. So opening stocks, so we'll need you to put in stock that is in the main store, and then we'll need you to move that stock to the main pharmacy so that we can track that movement for you to be able to dispense. So in the system, you remember we were tagging locations to whether they are main store or main pharmacy. So in the system, first of all, for you to do those operations, you have to be a pharmacist. So I'll log out, because the pharmacist is the one that has rights to be able to do the stock operations. Then I'll log in as a pharmacist. Then after logging in, I'll assume that I am at the main store and I want to do opening stock. So when you log in, you'll be able to see the stock, the different locations that we had created under locations. So it will be the name of the facility, the main store, and the main pharmacy. Unfortunately, the others that I created are not reflected. So you'll say main store, then you confirm. So now we have a pharmacist who is stationed at the main store who wants to do now opening stock. So we're doing the opening stock at the main store. So we'll go back to the manage stocks. We click on operations. Give it a few seconds. So once you're here, so now you can see that with the roles of the pharmacist and being at the main store, we can be able to see the different stock operations, and then we'll click Start New. So we're going to do opening stock of maybe 2 or 3 drugs, and then be able to follow through until these drugs get to the main pharmacy. Then we'll be able to also dispense the same drugs. So for you to be able to perform opening stock, you'll just click opening stock. choose a location. So we are the main pharmacy. We are the main store. We are doing the opening stock. So the location will be main store. The person responsible will be the pharmacist who is logged in. So I'll use the account, the pharmacy. If they have any remarks, this is where you'll be able to document the remarks. Then I'll click next. Once you click next, so this is where now you get to start loading the drugs one by one. So I'll work with paracetamol, tablet 500 mg. So we'll do opening stock for the paracetamol. Unfortunately, we had loaded this earlier, so you can be able to see it tells you the number of tablets that you already have, the details of the stock that is available in the system currently. So assuming these are another set of paracetamol that we've had in the store and it had not been loaded in the system, you'll search for paracetamol, you'll put in the batch number, just put a random number. Then you'll put in the expiry date. Again, you remember on the overview, we had a set of drugs that we are able to tell they expired or they're almost expiring. So this is where you get to document expiring and it calculates from here. You'll put in the quantity that you have in the main store, assuming we have 10,000. Then you'll be able to specify whether it's a tablet or it's something else. So we'll say tablet. And then the purchasing price really doesn't really matter, but we request users to leave it blank. Don't put any figure there. And then I'll also do the same for aspirin. So I'll also do opening stock for aspirin, 100 mg oral tablet. So if the stock is not there, this is because you'll find that in this facility, they had aspirin at some specific time. Then the aspirin is no longer in stock in that facility. So that's why it's written out of stock. So I'll put a batch number. I'll also put expiry date. I'll put quantity, the 1,000. Then I say the 1,000 is a box of 10. But again, this field is configurable. You can be able to change this to tablets if you want. So I'll just say a box of 10. Then I'll clear out the purchase price. Lastly, I'll do for ibuprofen, 200 mg. Put in the batch number. Specify the expiry date. The quantity. And then specify whether it has come in terms of boxes or tablets. So I'd say tablets. Then I clear out the purchase price. So normally it's advisable to do all your opening stocks, like basically do it one time. So you'll be able to add literally all the drugs that you have in your main store, literally add all of them. Then once you're done, then you click on next. Then the system will ask you, does the transaction require approval? So if it does, you say yes, then you submit for review. If no, you say no, and then you click on complete. And then it asks you if you really want to complete the operation, then you just say submit. Okay, so once you've entered your drugs at the main store, so now, assuming now the pharmacist at the main farm wants now to request for drugs from the main store so that these drugs are available at the dispensing area, which is either the CCC pharmacy or the OPD pharmacy. So again, we assume location. So what we do is we change location from the main store to the main pharmacy. Again, this depends. If the facility has only one pharmacist, the way I had mentioned earlier, then you simply just change the location. The credentials remain the same. But if the facility has different pharmacists, then the pharmacist at the main pharmacy will most definitely do this operation from the main pharmacy. So we'll change our location to the main pharmacy to assume that you're making requisition from the main pharmacy. And you can also be able to see our opening stock and the drugs we requested here, and the date, the person who did the opening stock, and the location. So once you change your location to the main pharmacy, so now we want to request for the drugs that we've we have in our main store, so that we can have them also in the main pharmacy for dispensing. So you'll basically click on Start New, and then you do requisition. So you click on requisition. So you'll choose the source. So you're at the main pharmacy, you're requesting for drugs from the main pharmacy, but you're requesting it from the main store. So you're at the main pharmacy, you're requesting drugs, the requisition is going to the main store. So from is the main pharmacy, to is the main store. The person responsible, I'll still use the account for my pharmacist. Pharmacy. If there's any remarks to be made, you'll put the remarks. Then I go next. Then now I'll search for the items that I want to request for. So I want to request for ibuprofen, tablet 200 mg. So it will tell you the available tablets. So it has added to. So whatever we've just added in the opening stock has been added to whatever stock was available at the main store. So that is why we are now seeing 2.404 M tablets. So I'll say we are requesting for maybe 50,000 tablets. And then also paracetamol, tablet 500 mg. So I'll say we are requesting for maybe 100,000 tablets as well. Then I click next. Does the transaction require approval? I'll say no, but we've seen that if you say yes, you submit for review. So I'll say no, then I'll complete. Then you submit. So once you've requested for stock, then the next thing that will happen is the person at the main store will need to issue the stock to the main pharmacy. So again, you're going to assume location. So we're going to change our location from the main pharmacy to the main store, still assuming that we are working with a facility where we just have one pharmacist. So we'll assume we are now at main store. So at the main store, we'll do stock issue. So for you to issue stock, you'll simply click on the, as you can see, we have a requisition here, whatever we've requested for. So you'll click on the requisition number. Once you click on the requisition number, I know there's been concern that if you click here and you click stock issue, it doesn't work. That is true. We are still working on having this operational. So for now, for you to do stock issue, you'll click on the requisition number. Then to your far right, just before print, we have issue stock. You'll click on issue stock. So you'll be able to see the details of the person who did requisitions. So that remains as is. So you'll click next. You'll be able to find the stocks that were requested for. So all you need to do is to be able to indicate the batch number. Again, as I'd mentioned before, in a facility, you can have so many ibuprofens that were brought to the facility at different times, and so they have different batch numbers. And all these are in the system, as you can see, they've been added here. So you need to be able to check exactly from which stock do you want to issue. So I'd requested for ibuprofen, I'd requested for 50,000. Yes. So I'll select from stock that will not give me a negative figure remaining in the stock. So I'll select the first one. So basically from the batch number, you can be able to tell the batch number and the quantity from that batch number that is remaining in the facility. If you just put your cursor here, like I'm doing, you can tell the batch number of the drugs, ibuprofens that you have in your facility and the quantity. If you put the second one, you can see the batch number, and we have 600 of those, 79,000 of those, again 79, like that. So I'll select the first one. I say I want 50,000 boxes of those. Then I'll also select paracetamol. So I want 100,000. So I'll select from a stock that has more than 100,000. Just give me a second. Okay. So sometimes in the facility as well, again, as we all know, you can request for 30,000, but whatever is actually from that stock, you're not able to get all the 30. So I'll just be able to edit this. I'll just edit this to 1,000. I'll just edit the quantity of the stock I'm giving to 1,000. So basically all you're trying to say is you can be able to also edit the quantity that you're able to issue out. So I'll click on next, say the transaction does not require approval, then I dispatch. So that is basically stock issue. I knew it was going to give me a negative, but it's fine. We can still work with ibuprofen. So once you've done the stock issue, then for you to complete the stock issue, so that now the issuing of that stock is now complete and the drugs are in the main pharmacy, you again come back, still at the main store, because the operation is completed at the main store. You click on the stock issue number, and then you click next. Okay, the paracetamol drugs that were more than what we requested for is giving me a problem. So what I want to do is I just want to repeat that process. Just give me a minute. Okay, so let me cancel this first. So sometimes when you get such kind of an error where when you're doing the issuing, you can't get a stock that has the exact amount that you need, you can basically do another requisition. Sorry, let me just change my location to the main pharmacy. So it'll take a very short time. So I'll request for the same drugs. Because now you can't use that operation to proceed. And this time, maybe I'll just request for 1,000 for each of those drugs. But at the facility, I believe we should be able to have the right quantity. This is a test instance, so we have so many test data entered. Issue the stock. So I'll change my location from the main pharmacy to the main store. And then I do the stock issue. So I'll now pick from stock that has more than 1,000. Same case with the second one. And then I'll click on next. Then I say it does not require approval. Give it a second to load. Okay, so you can now be able to see that the stock has been dispatched from the main store to the main pharmacy. But now to complete the dispatch process, you have to still click on that number and then click on complete. Then you submit. So now we have our stock in the main pharmacy. The process of issue is complete. So now we can go back to our main pharmacy and then we can be able to dispense this drug. So before we get to the dispensing point, I also want to show because another colleague of mine is coming to handle the dispensing part. I wanted to show the stock reports that we have. So if you click on the reports, I'm just going to log out so that I log in with the account that is able to access reports. So remember, we had created 3 accounts, and now the account, when I was logged in with the pharmacist account, I could not be able to see the reports, the historical reports that had been generated before. But when I logged in with the reporting account, I'm now able to see the different reports. So when you click on reports, then you click on new report. Then we have a couple of reports. When you click on filter, we have a couple of reports down here. So you can be able to see the stock status report, stock consumption report, the stock receipt report, stock issue report, dispensing logs, prescribed drugs report, fulfillment prescriptions report, stock focus report, stock expiry focus report. We have the stock out reports, stock expiry, transfer out, transfer in, and the most moving and the least moving items. So you can be able to choose the report that you're interested in. So I'll click on stock consumption report. Then I say I want a report on all my inventories, regardless of whether they are drugs or non-farms. Then I'll say I want a report for the past 3 months. So I'll select the period from 1st of January 2021 to the last date of March. Then I'll say I want my inventory by location and stock items so that I'm able to see where my stock is at. Or from the time I received my stock, whether it was from the main store, from the time I received my stock and where they are right now, how many are remaining where. And then I choose location. So again, you specify, do you want to see stock consumption report for the main store or do you want to see for the main pharmacy? So I'll select main pharmacy, then I'll click continue. So you can be able to see the report generating. So it takes a very short period of time. But I generated the same report earlier. You can see the stock consumption report that was generated today at 12:36. So for you to be able to view the report, you will click on this button here to download the report. So the report will be downloaded as we wait for the other one to generate. I think it has generated as well. We'll use this one instead. So you'll generate the report. You'll download the report. So I'll click on it to open it. Please confirm that you can see the Excel, Songok.
Yes, it's visible, but you need to zoom it in because the print is too small.
Okay.
Yeah, just zoom in a bit.
Okay. So this is the consumption report. So you'll see your stock. So you'll see the generic name, the drug, the trade name, the common name. These are some of the names that comes with the drug list that we normally import. Abbreviations for the drug, then the category, then the location. Remember, we requested for consumption for the main pharmacy. Then you'll be able to see the opening quantity, the quantity received, quantity consumed. So assuming you're done opening stock, then at some point you received some drugs, maybe externally, then the quantity that has been consumed so far. Then as at the date you are requesting for the report, what is the closing quantity? Then you can be able to tell the consumption rate. This is supposed to be by percentage. And then the unit of those specific drugs, the pack size, reorder level by unit, reorder level by pack size, the drug ID, and the concept ID. This is supposed to be giving some values for these drugs. Unfortunately, it's zeros. Again, I mentioned this is our test instance, so you may not really be seeing what is supposed to be there. But we urge you to try and generate this report from your facilities. I know facilities who've been able to actually get data from this report and consumed it. So that is the consumption report. You can also be able to generate for all these other reports, which we may not really be able to go into right now because of time. But just get starting at the facility level, generate the reports, and maybe you can give us feedback if you find there's a place we need to improve on, or if something is not generating correctly. So I'll hand this over to Eric Mudomi now to take us through the dispensing of drugs in the system. Eric, are you on the call?
Thank you. Yes, thank you, Frida, for that good training on the management module. Just allow me to share my screen. Confirm that you can be able to see my screen.
Yes, we can see your screen.
Okay, thank you. So I'm going to take you through the raising of a prescription. Then once I raise the prescription, which is done by the clinicians, I'll show you how we'll be able to connect now when it comes to dispensing and how the pharmacist can be able now to utilize and be able to deduct from the commodities that Frida has just shown us on how to be able to receive in the commodity management module. So just allow me to log in with my user who has the clinician role. So I'll pick the name of the facility so that I can be able to raise. Then allow me to search for one of the patients that I can be able to work with. So this will be my user that I'll be working with. So what happens, I'll just go direct. There are two ways of raising a prescription. If you are using the clinical encounter that you can be able to access under the clinical forms, within it, you can be able to do the prescription of the drugs. Again, at the top right where my cursor is, you can be able to see the order basket. And when you click on the order basket, you can be able to raise the prescription from here. Where we have the drug orders, just click on add. And then can be able to search for a drug that you want to prescribe for your patient. So I think let me use paracetamol that Frida received into the our stock management module. So you'll be able to see it here. For easier movement of this, just click on the order form. Then you'll be able even to see what is remaining under the main pharmacy. So there is that view whereby the clinicians can be able to see what is remaining, and even they can be able to see if it's something that we need to pay for, then they can be able to see the various modes of payment and the amount of money that this particular drug cost per tablet. So then I do the prescription, so that I'll need to start from here so that you can be able to see how dispensing happens. So allow me to do the prescription. I'll say I'll take this drug 1 × 3, which is taken orally. So the frequency then we have the patient instructions. These are additional ones that you can even be able to include here. For example, we've been given an example there, take after eating. If it's necessary, we can even be able to add, even under where we have the reason as to why we are taking this medication. When you check this box, then it allows you to type that particular section. Then you get to the prescription duration. This is the start date. When you are doing the prescription, the system will automatically populate the day when you're doing this or you are raising the prescription, which is the encounter date or the visit date. Then you can be able to key in the duration. For how many days you will be giving this particular drug? Let me say 5 days. Then we have this particular section on the dispensing instructions. So the quantity that you're going to dispense. So if you look at the duration that I've given, and even the dosage instructions here, which is 1 tablet thrice a day. So I can be able to multiply that and be able to get the 15 tablets that you should be able to get from the pharmacy department. Then you can be able to give the indication, which can either be either the diagnosis or maybe the reason as to giving this particular drug. Once you've done that, then you can be able to confirm that you've filled all the sections that are needed, and then you can be able to save that order. When you save, the system will be able to show you the drug that you've just prescribed. The reason as to it takes you back to this particular section, it is just to allow you to add multiple or to do multiple prescriptions. So you can add another drug, even the second, the third, until the ones that you want to prescribe to your patient. Then after that, once you have done, then you can sign and close. Then once the system saves, then you'll be able to be notified that it has placed that order and the item that you've ordered. Then after that, now we'll have raised that prescription. Allow me to now navigate to the other section whereby we want now to see, as a pharmacist, when you log into the system, how do you prescribe? So allow me to use the same user given a right to access even the dispensing app. So when you click on the at the top right where we have the KenyaEMR modules, when you click on the KenyaEMR modules, you will be able to see various modules there. So you can either search for a module, and this particular moment we want to dispense, so you can search for dispensing app. Then once you see it, you can be able to click on that. The system will be able to open that for you, and then you'll be able to see all the prescriptions that have been raised by the clinical or the clinicians. Then you can be able to see the one that you just raised. It is the second one here. The date when it was created, the name of the patient. This is now the clinician name who was the prescriber. You can be able to see my name there, and then the drug. When you expand, you can be able to expand this to be able to see more, whereby you'll be able to see some of the prescription details. If there is any allergies that was recorded by the clinical team, you can be able to see it. And other history and comments, if you can even be able to see them under this particular section. So this is what was prescribed. Then at this particular level, you can either close if you feel you don't want to have this prescription, and closing you are doing away with this prescription. And when you click on the close, it will be able to ask you before you save a reason for closing. So this is whereby you're closing this particular prescription permanently at the pharmacy section. Then we have the pause. This is in occasions whereby maybe you wanted to give this particular drug, but the drug is not enough and you want to pause for a moment, and then once you receive these particular drugs later, you can be able to prescribe. That is when you use this pause, and we have reasons as to why maybe we want to pause. Then when we raise, currently the server that we are using, it has been configured to raise a bill the moment you just do an order. It is a configuration whereby you can be able even to configure so that, again, we can even raise it at this particular point. But for this one, it has been configured whereby the moment you put that order, then it cannot allow you to dispense until you settle this particular bill. So for me to be able to show you on how to settle this bill, allow me to clear this particular bill for our client. So for you to be able to clear that, you navigate to the home page, then where we have the billing module, you expand, click on the overview, then you'll be able to see all the patient with a bill. Then you can even be able to filter using any of the identifier. So you can be able to see our client here, Charles, with the item that you're paying for. There are modes of payment, and because just allow me to clear this because today we just only want to clear on the management module together with dispensing. I know we'll be having another section to show you on how to manage bills. So I will say cash. Then I'm supposed to pay 750. So there are various modes, even having the M-Pesa payment whereby STK can be utilized. Then I'll process. So once I process this, allow me to log out and log in again with my user. Again, something to note, the location, and I think Frida talked about this, it is very much important. So for me to be able to dispense, I need to be at the dispensing area, which is the main pharmacy. So I need to click main pharmacy, and then I can confirm again KenyaEMR modules, dispensing up. Then I'll be able to see my client here. And when I now be able to expand this, it will have opened up for me to be able to dispense. But then before I dispense, if let's say I want to give a prescription, we have an option whereby you can print this prescription. Then if there is need, sometimes the drug may be out of stock, but the patient want to go and buy this particular drug in maybe in another chemist outside the facility, so you can be able to print this prescription and give it to the patient. So how do we dispense? Just click on the dispense. Then the system will be able to show you what was prescribed by the clinician. Then if there was any instructions, would have been able to see them there here. Just need to pick the person who is dispensing, and then you'll be able to see all the batches now here, so that you can be able to pick from various batches. So at least from this, you can be able to see how they are. The first one is 2025. You can be able to see the other one on to 2027 coming after the one for the 2025. So if I may take this one, you'll be able to see even the expiry and the tablets that are the quantity which is remaining, which is 8,000, but I just want to give the 15. So I can be able to do that. Then be able to dispense that. Then it will be able to show that the medication was successfully dispensed. So that is how we're able to do the dispensing. Over to you, Frida.
Thank you, Eric. Okay, let me just reshare my screen again, so that we are able to also show the other reports, like the FCDRR that we also have in the system. Okay, I hope you can see my screen.
Yes, we can.
Yes, we can.
Yeah, so apart from the stock reports that we have, someone had mentioned concerns regarding the FCDRR report that they may need to access from the system as well. So you'll have to go back to 2.x. Then you click on EHR reports. Then you'll be able to get the FCDRR report. We also have the FMAP MOH 729 report. So we have those two reports that are currently available for you to be able to manage your stock. I think that's it. Back to you, Franklin.
Thank you. Thank you very much, Frida, for taking us through the demo. Thanks also to Okoto for taking us through the first part, the introductory part, just preparing us on to what we want to, what Frida and Eric has taken us through. I think we can appreciate the fact that it is important for us to be able to ensure that we identify and assign roles to and do the configuration within the system, depending on the roles of each and every service provider within the facility. Frida, you've also been able to take us through how to make sure that we add the stocks within the system. Basically, just loading the system with whatever amount of drugs that you have, depending on which ones, and also how to keep track of all the stocks right from the time they are loaded, the dispensing and all that, and Eric for just focusing majorly on how to dispense. And I think you've also touched a bit on our next session next week, issues around billing and billable services. And then finally, Frida for just taking us through how to generate the reports, the FCTRR, which is very, very important, because at the end of the day, all this has to be accounted for in terms of generating a report within the system. And I think that was also one of the questions that was raised earlier. Before we go to the Q&A, I think there's some bit of clarifications regarding the workflow. There's some bit of clarifications that Kezia, I don't know if it's Kezia or Diana, that they needed to just make before we go to the Q&A. I think there was a concern that was raised earlier, and Kezia was to make some bit of clarifications. Kezia, I don't know whether you have a mic right now. Are you able to speak?
Yes, I can.
Okay, go ahead.
All right. Thank you, Songok. Good afternoon, everyone. Just a quick clarification on what you've been taken through this afternoon. You'll note that Frida did so many operations or so many transactions during her session, but we all can agree in a facility, it's very rare that you'll do all that in one sitting. When you're receiving drugs, it may not be the same time you'll be requesting, and it's not the same time you'll be maybe updating the opening stock. So some of those roles are done by different people. There is person who will be receiving. The person receiving may not be the same person who will be requesting for stock. And even the roles are different. You may find not everyone, unless it's the admin, that is when they will have all these roles under their account. So this is for the training purposes, for you to be able to see what are you able to do within the system. But it's very unlikely that you'll do all these transactions in one sitting. So it may seem like it's too much. There is a lot of back and forth, but let's just look at a typical facility and how these different tasks are performed and by who. Because every role will go to the rightful owner. If it is the store manager, they'll do the receiving. If it is at the main pharmacy, they'll do the requisition. And then the store manager will service their request. So we did all that for the purposes of training, but we expect that now you'll be able to replicate this in your various facilities based on the workflow and also based on the personnel that are in your facility. So if you are in a one-stop shop, one where all the services are offered in one place, then you'll be assigned all these roles and you won't need again to keep on changing places, because you'll have to, you'll be given access to perform all these tasks in one. So it will all depend on the type of facility you're working in, the workload you have, and the roles that you have. So let's not confuse and think that all that Frida did is what one will be required to do each and every other moment. It is one task at a go. So we just needed to make that clarification so that we are all on the same page. Over.
Thank you, Frida. I think that's Kezia, sorry. that's very important for us to be able to just draw the line that the system doesn't really change the processes that are being undertaken at the facility, and this will vary from one facility to the other. So the workflow that Frida took us through, I just needed to just add some voice on what Kezia has said, is just for purposes of learning. But the processes at the facility level will still remain the same. But it will be important for us to ensure that once you've been assigned a role as a store manager, and then you know your responsibilities as a store manager, and those responsibilities and those duties will be managed at that level at that particular time when you're seated in your office. So it's not that all this will be done by one person. So thanks Kezia for that clarification. I feel it was very important for us so that we just have a common understanding of the same. And I can see Frida's hand is up. probably maybe you still want to add your voice on the same, Frida?
No. I think we forgot to mention some of the things that the facilities had been requesting for and have been worked on, but unfortunately we couldn't show. But they will be coming in the next version. I think it's important to state. So we have the adjustments. So currently now we have what has been modified in the system in the version that is upcoming. We will now be able to have the positive adjustment and the negative adjustment. And then there is also the question that has come up a couple of times, why we are not able to raise the bill from the pharmacy. So that has also been worked on, or it's a work in progress. So we should be able to get that in the future or in the next version. Should be able to raise the bill from the pharmacy after the pharmacist confirms that the drug, that the patient is able to pay for the drug, or that they're paying for the exact drug that they'd like to have. I wanted to make that clarification. Back to you, Sungok.
Thanks, Frida, for that clarification once more. Yeah, because of time, I can see we only have 9 minutes to the top of the hour. I know we also started a bit late because of the technological itches we experienced earlier, but I think we can then move on to the next session, the Q&A, but I can see there's a hand from Robert. I don't know whether it's Robert, you have a question. Maybe probably we can give you an opportunity to go ahead and ask your question, Robert. Ogutu, you can enable Robert to speak. Meanwhile, I know most of the questions have been responded to on the chat, and thanks Adeline, Marianne, Diana, Ezia, Eric, Rajab for responding to the questions on the chat. Robert, are you able to speak now? And there's also Jen Kirua. I don't know that there's any question pending on the chat wall. Meanwhile, I can quickly just run through and see if there's any. Ogutu, let me know when. Yes, Robert, you can go ahead.
Yes, my concern was about it was raised last time concerning the prescription. The kind of prescription we requested is not what we are getting at the moment. I don't know whether it is also still under the development, because we were requesting something that can give us a clear picture of the client, the drugs, and even the diagnosis. Like we wanted the diagnosis, you can see the diagnosis, which is very vital for a prescription. We wanted to see like the vitals, which is also very key when it comes to calculating the dosage. We needed something like even the lab diagnosis. The lab results, which also can help us as the pharmacy, because these are for the medication issues. These are also very vital for us at the pharmacy. I don't know whether it is coming up in your next module or not. Maybe you can clarify. Then another thing I wanted to, just a concern, instead of like once you are done with the dispensing app, you dispense to the client. There is always a box there where you are supposed to check in, and it normally I always believe that it is for checking out the client. But once you click that box, then you go back to the queue, you still find the client in the queue. So I don't know the intention you had with that box where we are supposed to check in during the dispensing. But if in case it's not working at the moment, then can you make it work? Instead of dispensing, then you go back again to the queue. I think it's a long process. So just checking along that box is enough that you are checking out the client. Then another thing I think one was on the chat box. Another question was on the chat box, but I'll check whether it has been responded to. I think those are them.
Thank
The
you.
ones I wanted to ask someone. Yeah.
All right. Thank you, Robert, for your questions. I think your first question is basically you're inquiring whether at the pharmacy at the dispensing desk you are able to see and view the clinical notes, and probably if there are any investigations, whether you are able to view. Yeah, the team should be able to respond to that. Then the other one was on the check-in. Matoso L Center. I can see your hand is up. Robert, you can probably put down your hand, and then we can go to you. Kennedy, you can allow.
Excuse me. Can I put another one? The other one was about the bin card. Kindly don't forget it. The issue of the bin card. Yeah.
Okay. I think you had asked that question previously. That's fine. Ogutu, Francis Omondi, you can allow them to speak, and probably I guess that should be the last ones. The rest of the team members, in case you have any concerns or any questions, you can always reach out to the team. I think Ogutu and team had posted the toll-free line. You can always call. Francis, you can go ahead. Robert, you can mute your mic.
Francis, you can unmute. Francis Omonde Nyango, just unmute the mic and talk.
Yeah, thank you. And I know I'm standing between the last minutes of the time. Really to appreciate the presentation. And I just wanted, it's a request or a clarification that I'm seeking. Yeah, granted that the basics of commodity management, whether for pharmacy or lab, would follow the same workflow that we've taken through. My request would be that if we can have a specific module on the lab commodity, there could be some change. There could be some variation on the workflows, especially on how the lab commodities are utilized in the lab. That may differ slightly with the commodity, with the pharmacy commodities. So my request would be that if it's possible, we can also have the same, so that the lab colleagues can also just be taken, so that when they take up these in their facilities, then there would be uniform utilization instead of people going into it and trying to maneuver around to maneuver around so that the lab commodities can fit in here. I think I'll back to you.
Okay, thanks, Francis. That's well noted. So, Frida, maybe you can respond to like the four questions from Robert. That is whether they are able to view the clinical notes, including diagnosis, the investigations, then the check-in. And then the issues around the bin cut, and then finally from Francis, whether we have whether we have plans to develop a specific module on lab commodities. And I think that helps to generate the MOH, the commodity, the lab reporting tool, which is MOH 643. So Frida.
Thanks, Franklin. So for the diagnosis and the additional information that is being requested for, this is a work in progress. Actually, the team has been able to add even the age, which was not there. And we are hopeful that the next version will have at least some of this additional information that has been requested for by the pharmacist also available on the patient's profile just before you dispense the drugs. So that is a work in progress. The checkout box that used to be there just before you dispense, unfortunately, the current version, it was removed, but we're still working on a way to ensure that it actually works. That's why it was removed. So once we've sorted that out, then I think it will be returned back so that when you check out, it actually checks out the client from all service areas, and you'll not be able to find the client still in the queue as was before. For the bin card, I think Eric is sharing his screen shortly. Eric, maybe you can share your screen so that we can show you. We already have worked on that. Again, it will be available the next version, but we've been able to incorporate the bin cards in the system. As you can see, Eric is showing. And maybe Kezia can help comment on an elaborate module on laboratory commodity. So, Eric?
Thank you, Fred. I think it's there. So when you navigate to the module, and then under the items, you can search for your drug or commodity, and then you can be able to click on it. Then under the transactions, you'll be able to see the movement of this particular commodity. And then you have somewhere whereby you can be able to see the stock control card and the bin card. So we can be able to have them, and you can be able to see the content which is there. This is something that is there. I think we can be able to see that. And I think, Frida, you've responded to other question for plans to have the lab commodities.
Yes.
So maybe to respond to that question, this is not only for the drugs. I think only that we used a drug. It is for both pharmaceuticals and even non-pharmaceuticals, and even what can be used in the lab. So we want to have it within one module. Kezia, you want to add any other on the lab?
Nothing much, but maybe I can make a request to have a user group for the lab people again, so that we just have a look at what is available and explore if that suffices for them. If not, then we can discuss on a way to have all their needs accommodated in this module. Over.
Thank you, Frida, Eric, and Kezia. So I think we can take the last two because it's a minute past 4. Remember, we intended to end this call at exactly 4. So I can see there's a hand from Joe and another one from Forum. So we can start with Joe. Ogutu, maybe you can allow the two to speak. We'll start with Joe.
Joe, you can unmute.
So meanwhile, as Joe unmutes, you can enable Forum also so that you can go ahead after Joe. Joe, go ahead. Joe, if you're speaking, I can't hear you. Forum, Ogutu, have you enabled Forum?
No, Forum's mic is unmuted.
Good afternoon.
Good afternoon to you.
Thank you for this training session. So for at Lumumba, there are quite a few issues that we have. As you've taken us through the pharmacy module, it is something that we've been following. But when we raise requisitions or bring medication from the store to the pharmacy, despite entering all these figures, it does not reflect. This is something we have complained about severally, but it has not been addressed. So I don't know what the way forward is, because we can't keep performing requisitions that are not going through. Even if a drug suddenly runs out, and there's some drugs that we have, it is already entered in the system, but it still reflects as 0 or out of stock. And if we try to add, it still does not reflect. So I hope you can address these issues.
Thanks for your concern and raising the question. I don't know, Joe, whether you are able to speak now. Matoso, your hand has been up and down. I don't know whether your question has been asked or it's been responded to, but if it's been responded to, then that's okay. Joe, are you able to speak now? Right, it seems Joe has difficulties with the mic. So meanwhile, maybe Frida, you can respond to the concern from Lumumba. Then I think we'll close it at that.
Yeah, sure. I think we'll be able to reach out to and work with the partner to be able to access the system so that we are able to find out where the problem is. So we'll work with the partner in the facility, but the facility is on cloud.
All right, thanks. So I think that's a commitment from the team, Forum. That's a commitment from the team that they'll be able to reach out to you and help sort out that. Right. So I think we do not have any other questions.
Sorry, Franklin. Just one last comment. I think I forgot to also mention this. So for again sites that are actively using the system, the other issue that came up that was that drugs that were out of stocks were also being billed. So this has also been sorted out. So right now, if a drug is out of stock, that drug will not have to the drug will not generate a bill first of all. So that means that the patient can basically maybe just be given a receipt to go and buy the drug outside, but it will not limit any other operation to be done to the patient within the facility.
All right, thanks.
Back to you, Frank.
Thanks, Frida. I think maybe probably you could also go ahead and respond to Joe's concern. I think that he wasn't able to verbalize it, but he's posted on the wall, and he's made a suggestion. I don't know that that's possible. So what he's suggesting is that we probably perhaps upon dispensing the drug, to reduce the queue, disable the button for dispensing the drug once dispensed. Frida, maybe a quick one on that.
Maybe we can have Rajab also try and comment, but I believe currently you are only able to dispense once, unless you've not dispensed the entire quantity. Let's say, for example, the prescription was that you dispense 100 quantity of 100, and you've dispensed maybe half or not the whole 100. Then you'll still be able to see the button of dispense active until you completely dispense the entire quantity. But if you dispense the whole quantity, then the drug there'll be a notification complete, and you'll no longer be able to either close, dispense, or pause. Rajab?
Okay, thank you, Rajab. Quick one.
Yeah, thanks, Frida. Yeah, I think that is one of the issues with that. But then another thing is that when doing prescription, remember there is that field that some of the clinicians usually fill, which is the number of refills. So remember, if you put a figure there under the number of refills, it practically means this patient is supposed to come back for those number of refills. If you put 3, it will still be active until the patient completes the number of refills for that particular drug. So when you're doing prescription, maybe we need to take note of that, so that if a drug is basically issued once, you don't need to fill that field for a number of refills. Over.
All right, thank you, Rajab and Frida. So, so I think we've with that we've come to the end. I can see the dropout rate is quite high. So, with that we've come to the end of our virtual training. And on behalf of the team, I think I want to take this opportunity to appreciate all of us for finding time to attend. Just one announcement is that we've lined up quite a number of series of trainings. So we'll have another virtual one next week on Thursday, same time from 2 to 4. And next week will be majorly focusing on the billing and billable services, and also just looking at the processes around e-claims. The main focus will be how to create the bills, how to process the bills, and how to set up some of those services that are meant to be filled. And I know, again, in our facilities, there could be 1 or 2 clients or patients or clients who may need waivers. Then how do we go around that? What are the processes and the approval processes that we need to go through? And then again, and I think those are the main areas that we'll be able to talk about. And I think on that day, then we'll close it up with issues around e-claims. So at this point, I want to say thank you to everyone for attending. I know I'd seen quite a number of CHRIs who had joined. I don't know that they're still in the call, because I would want to just give them an opportunity to say hi to the team. And maybe one person, I think I'd seen also from Vihiga, and we had Ruto from Kakamega, and I think we also had the CHRIO from Nyeri. So I don't know that, Ruto, are you still in the call? You can just speak on behalf of the CHRIOs as we close. Or any other CHRIO still in the call. I know probably they may have dropped, some may have dropped. Any other CHRIO in the call? All right. Okay, fine. So I think we can close it at this point. Thank you very much for finding time to attend. We really appreciate you, feel appreciated. Let's continue working closely so that we can scale up and utilize the modules that we've been able to develop in EMR. So thank you very much and have a blessed evening. Thank you and bye.